What's up? My name is Roslyn, and you are now listening to Americanized, a storytelling podcast where you'll hear from eclectic first and second generation Americans share their stories and real life experiences as children of immigrants. Hey there, thank you so much for tuning into a new episode of Americanized after the hiatus. I'm so very excited and happy to bring this episode to you with its focus on mental health. So happy May, happy Mental Health Awareness Month, and though this month is coming to a close, that is no reason to stop prioritizing or even thinking about your own mental health and mental wellness, ways to cope, and ways to take care of yourself. In this episode, I had the pleasure of talking with my former grad school professor, Amanda Rodriguez. She is the mental health advocate and enthusiast. She taught mental health, which is now referred to as psychosocial. She taught those courses for my occupational therapy degree, which I am now studying to sit for the board exams pretty soon. So I'm asking for positive energy, prayers, and support from all of you. In this episode, we discuss her background with mental health studies, mental health from an occupational therapy, or OT as occupational therapy is abbreviated, OT perspective, OT point of view, which includes sensory processing, trauma-informed care, the stigma that comes with mental health, and the recent uprise and awareness of mental health within society, I think especially during the pandemic. We also discuss a lot more things for you guys to take away and a lot of gems that'll just really enlighten you, so do stay tuned. But how have you been? I haven't seen you since probably the pinning. It's like 2
Oh my goodness, it's so long ago.
Yeah, it's weird.
Well, the pandemic happened in between.
Yeah, that is true.
I had a baby.
You did?
I'm not sure if you know that. So I have an almost 1-year-old now.
Wow.
So things are very different at the same time, very much so the same. I just have someone I get to play with now.
Yeah, no, that's really cool.
Yeah.
How was it like being like an OT mom?
Oh my goodness. Now that is something entirely different. I sort of had always thought, well, I was interested in pediatrics to some degree, but kids kind of terrify me. The idea that they could band together and sort of mutiny, right? They don't have to listen to adults. Mm-hmm. And so now having my own kid, I think there's pieces of that as she starts to age that comes in, but also just like the OT lens, being able to think about development and structuring environments for her to be successful. And even thinking about the language that I use when I'm talking with her. I think I take for granted or have taken for granted how much I actually know in helping her grow. When I see different Instagram posts or Facebook posts about, specialized areas and how to support kids' growth, I'm like, this is what we do as OTs. Like, we know this. I know this stuff. I'm already doing it.
Right. So, that's really cool.
Yeah.
So I want to start by saying I feel really lucky to know you and to have you as a psychosocial or mental health professor for my OT grad studies. You're just like a super memorable person, just your energy and your attitude and passion for mental health, mental wellness. Yeah, it's really inspiring.
Thank you.
Yeah, but before we get into the mental health talk, I do want to ask you to talk about yourself, your ethnic background, what you do, what your interests are.
Oh, man.
And the Dr. OT mom life.
Yeah. So I'm Amanda Rodriguez. I did get married, goodness, almost 2 years ago, but I still go by Rodriguez. And when I teach and I tell students that it is and I'm Dr. Rodriguez, that professional title is so important for me to connect to my last name, my maiden name. And that speaks to where I come from. So my father's Puerto Rican, and I have a lot of Puerto Rican pride. I feel a little bit, I don't know what word it would be, but I would love to speak more Spanish. So that's one sort of piece of the Puerto Rican pride that's missing. But when I became a doctor, that was one of the things that I thought, yeah, I want to be Dr. Rodriguez. I don't want to be Dr. my married last name. And that speaks also to the fact that I'm a first generation college student. So nobody in my family had ever gone to college, never mind got their doctorate. So it's pretty huge and pretty significant. And I think about sort of what my grandmother would say in Spanish, because she spoke no English, if she knew that her granddaughter had become a doctor. So I take immense pride in being called Dr. Rodriguez. I go back and forth about, should I change it at some point? And no, it's just going to stick. So my father's Puerto Rican. He grew up in Puerto Rico, came to the States, I want to say in the late 60s, early 70s. We have, I think about holidays and being together with family is very important, of course. And yet having a daughter, I named her actually after my grandmother. So really keeping, I guess, the cultural piece alive, which I really love to think about and love to do. Take a lot of, again, pride in. Other things to know about me. So occupational therapy is definitely a passion of mine. And it nicely integrates with mental health, of course. When I actually went to school to become an occupational therapist, I didn't know that OTs did all this other stuff besides mental health. So I was really thrown off when I had to do all these science-related courses. I was like, wait a minute, why do I need to learn about all these muscles and whatnot when all we're going to do is mental health related stuff? I realized, OT is this massive profession that touches on everything. Dr. Mom life, man, I'm realizing how important roles and responsibilities and identity, and all of that is sort of coming together, thinking about being a doctor, being a mom, being a professor, being a clinician, being, I still feel like I'm 7 years old sometimes. I just want to go out and play. And then I remember like, oh, that's right, I'm an adult. I'm supposed to be doing these certain things. So really just striking the balance between what makes me happy in all of that. I'm trying not to, feel too much of the societal pressure to be a certain way or to act a certain way, especially with the doctor piece. People say, oh, we'll refer to you as Dr. Rodriguez. I'm like, please, Amanda is fine. I like that. There's I recognize I worked hard. And at the same time, I'm a human and you could just call me Amanda. That works.
So. Right. Wow. That's amazing. That's really cool how you're keeping up with the cultural piece. You're carrying that on with you.
Yeah.
Yeah, it's cool. I remember, I think one of the last courses with you, you said you want to start speaking more Spanish. How's that going?
So I speak as much Spanish as I can with my daughter.
That's awesome.
And so she knows water as agua. So we've never called it water. So when she wants her little sippy cup, like she'll say agua, which is really cute because she's 11 months old. So it's like agua is what it sort of sounds like she's got marbles in her mouth. Mm-hmm. But it's like, I don't know, like something that just gets my heart to think like, oh my gosh, like that's just what she knows. Like she hasn't been taught anything else. Nothing has tainted her worldview where she's like, no, this is just the Spanish word. This is it. That's it. And I try to read to her some bilingual books at nighttime, which is really great for me because I get to practice my pronunciation and like work on the timing of how I read without, feeling like other people are watching. That's one of the things that gets in the way is that my anxiety around like, am I doing this right? And, am I really Puerto Rican and am I really allowed to claim this piece when I don't actually speak the language or maybe I don't pronounce things the right way? And so to read to her, it's just like, this is all that matters is our little bubble and I'm doing the best I can and we're having good quality time together.
I love that so much. That's so awesome. That warms my heart. I'm like stuck on that. That's amazing. That's really cool because I feel like with my family speaks French and I want to learn or I want to like speak it fluently. I know some words, but there's that pressure and there's that anxiety to like speak it out with my family because it's not right. Doesn't sound right. It's not. And then
so weird. I was just thinking about something related to this where like family parties growing up, like we just danced, like the music would be loud and people just started dancing in the living room around Christmas time. And when I was little, like that would be something I would jump into, no problem. Like, I don't know what I'm doing, but my aunt's going to teach me and we're just going to go with it. And then like, as I aged, as time went by, there's so much more like reservation that's put on that of like not wanting to put yourself out there. So I try to think about like, well, what is that? What is so different between being little and going for it and being an adult and going for it? Like there's nothing like, and if everyone just realized that, like we could do a lot of the stuff that we keep ourselves from doing.
That is so true. I want to dig into like what that is. I don't know like where to start, but that's something I want to find out too. Because I think a lot of people with like first generation, a cultural piece or different cultures coming to America and expressing that and being a first generation or second generation or not growing up fully like in the culture and then you're trying to dive in. It's like, do I dip my toes in or do I just dive in? Yeah.
And like if you like here, so when I shared my piece and then you shared your, hesitation about speaking French, that made me think, oh, it's not just me. Like how many other people are having that same experience? And if we all just realized, oh, you feel that way too? All right, then let's just do it, right? If we're all anxious, then let's just drop the anxiety around it because we all want to try it.
Yeah,
but
it's okay.
there is this, I don't know, this weird fear, not really fear, but something that we put on it. Like, just go for it.
Yeah.
So even thinking about meeting with you when you had texted, I was like, oh gosh, that makes me really nervous. But if something makes me nervous, then I probably care about it and I want to do well. And so why not just do it? Lean into the discomfort a little bit.
Yeah. And it's
try to do that like every now and then, just like not everything, but every now and then be like, okay, this makes me feel uncomfortable. I should probably do it. See what it feels like. I'll survive this.
Yeah.
You'll survive speaking French. It may feel uncomfortable, but nothing bad's going to happen.
Honestly, yeah. It's just practicing a language.
Yeah.
So funny. Going back to what you said, interesting how you thought OT was solely mental health and then it's all these other things.
Yeah.
And I feel like a lot of people go in with it. Like it's all these other things and then mental health is on top of it.
Yeah.
It's interesting. So what was your like transition from, because I know you studied mental health, you said in undergrad. So what was your transition like?
So I have my bachelor's degree in psychology. And then I went back for my master's 4 years later. So there's a little bit of a gap in between. I was working in a mental health field. So I was a direct caseworker. So I was like taking clients grocery shopping and helping them clean their apartments and helping them manage their medication. Eventually, I moved into this position where I was working on a day program, running all these groups and activities, and we had OT that came in. And long story short, I realized, wait a minute, I'm pretty much doing what these OT people are doing, but like they have the science and background to understand like how to structure things to get the outcome they want. I was just sort of willy-nilly like, all right, let's do cooking group today because it seems like you guys like to cook, but I didn't know how to structure things. And so that was my sort of take, was again, just seeing those OTs and seeing how they were doing this mental health stuff. And so transitioning into the classroom was, oh my gosh, I remember thinking within like the first week that I was in the wrong spot because everyone else knew so much more about all of the other stuff. So I didn't know like the terms for flexion and extension, like moving your arms, or abduction and adduction, and like seeing other students rattle it off, like made me feel like I was in the wrong spot. And then when we actually got into the mental health courses, and I was the student raising my hand, either agreeing with the professor or saying, that's actually not what I've seen. Like I have my own experience having worked at this point. Then I started to realize like, okay, I don't know this other physical dysfunction or physical ability side of things, but I definitely know this mental health side of things. And I love the way OT looks at the world. And so putting these two together just made so much sense to me. So I really found, I know, my niche pretty quickly. And I was definitely like the mental health person. And I think my professors appreciated that because I loved what they were teaching, but I also challenged them a little bit because some of their teachings were a little bit outdated or based on case studies from how many years ago. And it's like, actually, I literally just worked with this guy this morning and this isn't how it is for him. So that made me feel, balanced out, not feeling like I belonged, and really put me in this place of like, oh yeah, you know what you're doing.
Right. It gave you that confidence from your clinical experience and applying it to the classroom and challenging your professors.
Yeah.
That's cool.
Yeah.
What was their reaction like? Were they like, oh yeah, she
Um,
knows things, or hold on then?
I think oh gosh. I feel like one professor was definitely like, really, she's raising her hand again. But I also know that professor was like the mental health guru. And so I think she respected and appreciated that I was thinking critically about the stuff that was being presented and not just taking it at face value. So I thought, yeah, that's true. But what about this? And so I'd always be that little, did we consider this piece? Especially when it came to generalizations. That was something I really struggled with, was when we were talking about diagnoses, and it was like, they sort of always present like this. I'm like, whoa, 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 whoa. Like, people are unique and individual. So we need to honor that. And part of that too is like, my classmates had no interest in mental health. So I felt like I had to advocate for these folks that I was working with so that they knew, like, these mental health diagnoses aren't scary. These people aren't terrifying. Like, let me give you a real human perspective. And so that was me raising my hand saying, wait a minute, hold on, let me add this. And I do think, just now being an educator myself, students who do that, I love, because it tells me that they're paying attention and that they are thinking critically, and they're not just going, whatever the professor says is doctrine. Like, nope, you can have these varying perspectives, and that student may then go on to research something and add new information to what we already know. And so I would rather have a student that is sort of always challenging things than have a student who just like passively participates.
Mm-hmm.
Yeah.
A lot of students, or when you were in school, weren't like into mental health. And I feel that was the same when I was in school too. Like, I wonder if like there is this huge stigma towards mental health. I wonder if that carried through like with people who had to study it for school.
Yeah, I wonder, so recently I'm blown away by how many students are interested in mental health. And I've noticed this shift, and this is something I, hindsight would have loved to have documented to see how things actually have progressed. But I feel like so I do a lot of mentoring for students at other schools. And whenever I have Zoom chats and I say, what practice setting are you interested in? Like, a good chunk of them say mental health. And I'm like, what is happening where people are interested? And I think there is now, especially now, this shift where we think about what's happening, in our society with, unfortunately, like, I'm just thinking of like gun related issues, school shootings and whatnot, or, any sort of like criminal activity that people are now starting to think, how did mental health influence this? Or how could mental health help these situations? So especially when we think about like the defund the police movement, like, of course, mental health, getting people on the front lines there, that would make such a valuable impact. And so maybe that is sort of getting people to think about the role and the value of mental health. I'm not sure how it connects so much with OT yet. So I could see how society takes interest, but why are there suddenly so many OTs in specific that are taking an interest?
Oh, that is interesting.
Yeah.
I was going to say that there has been a great emphasis on mental health in general.
Yeah.
With like society, like they want to check on their mental health.
Yeah.
The mental health awareness. Yeah, the pandemic. Both pandemics, the virus and racism. And how like that's impacting everyone's mental health, mental wellness. Mm-hmm. Being stuck at home, like it's a lot.
Yeah, it is. And I think too, how do you get the word out about giving people grace in all of this too? So like, as people become more aware of their mental health, like, is there more panic around like, oh my God, is something wrong with me? Versus like, the world is challenging right now. Like, allow it to be challenging and give yourself some grace and recognize like, you may not be able to do the things you have done, and that's totally fine. Like, it doesn't need to be this huge reaction to things, but like, the world is tough. Okay. do the best you can. That's really what you can do. And
Right.
do the best you can is one of my sort of taglines that I like to say often.
Just do the best you can.
Yep.
What is it? The ACL.
The ACLS, yeah.
Yeah, I do
Yeah.
remember that. Yeah. That's a life. That's a pro tip for life. Just do the best you
Mhm.
can.
Do the best you can. Yep.
How would you define mental health or mental health is a broad term, and I think people include that with mental illness and mental wellness. So, what's your
Mhm.
own definition?
Ooh, good question. Well, I think of mental health similar to that of physical health. So we have varying degrees of physical health, and it could change on any given day, right? If we think about physical health, sometimes we eat really well, our bodies feel fantastic, which I would, reason probably connects to mental health too. So there may be days where you do things that are great for yourself and you feel wonderful from a mental health perspective, or you could have days where things just feel a little bit off. So it doesn't have to be this pinpoint spot where it's like, oh, my mental health is poor. Like it ebbs and flows throughout the day, is sort of the way I see it. And then there's, on the stepping back a little bit, this spectrum of sort of wellness and having really good mental health, so mental wellness versus being, maybe a little bit more stuck than usual. So you're sliding down to the other side of the spectrum. I don't see it as, a really concrete spot you can map. Like it's very fluid. And I, thinking about even mental health, I think about the language we use and, mental health, mental well-being, when people are having, mental health challenges versus mental health disorders versus mental illness. Like there's so many words, and words are such an important part of, like, of course, labeling things, but they carry so much weight. And so that's something I find myself constantly thinking about when I'm teaching, especially, is like, what word do I want to use to capture this? Because I don't want to reinforce this stigma. And I do want to communicate this idea of it being really flowy and spectrumy when we think about, I guess, our mental health.
Yeah, that's a good way to see it. Like it does fluctuate throughout the day,
Mhm.
and I do believe that it is associated with the food we eat, like that, and just like seeing it as a like physical health or physical wellness. It's all
Yeah.
part of taking care of.
And they're so, so deeply connected. And
Yeah.
that is something I could talk for hours or days about, how your body feels impacts your mental well-being, and your mental well-being impacts how your body feels. Like you cannot separate them.
Hmm.
So thinking about, what do you feel like when you're anxious? Like you feel your heart rate go up. Okay, an increased heart rate is a sign of a physical condition, and it's also a sign of your mental health, right? So like you can't separate those two out. So when I think about food, that's why I was like, oh yeah, well, food impacts how your body feels, and how your body feels impacts your well-being, and how your well-being probably impacts the foods that you're going to eat, right?
Oh,
A little bit more stressed and anxious, you're probably not going to eat the stuff that's so great. So your body's not going to feel so great. And here we go. There's the cycle.
yeah, it is a cycle. It's all intertwined.
Yeah.
Yeah, that brings me to the the vagal nerve. You emphasize that a lot, and that like so you shared with us a super long but informative PowerPoint. Like
Yeah.
I actually really love that PowerPoint. I've shared it with a few people outside of
Oh,
school.
wonderful.
Yeah, because I'm like, you guys have to know this stuff. It's so important and so like
Yeah.
just cool to know. And when you shared like sensory processing, like I was hooked on that. Like I just
Yeah.
that was so cool. So share about if you would like to share about sensory processing and interoception,
Oh my gosh.
vagal nerve
This
stuff.
is the stuff that makes me giddy. But
Yeah.
it's like so overwhelming. There's so much information out there. And
Hmm.
so I'm glad you said the vagus nerve. So the vagus nerve, I want to say, is cranial nerve number 10, if I'm correct, for those keeping track. And it is a sensory and motor nerve. So that means it takes in sensory information. So from our world, it picks up on that. And the motor part of it is that it uses that information to generate a response. So the vagus nerve is deeply connected to the experiences we have, how we feel things, because it's sensory. And it also is connected to the way that that is expressed, right? What you see, the motor piece. So when I think specifically about mental well-being, physical well-being, right, our vagus nerve senses things that are happening in our environment. And then its responses can be things like heart rate, dilating your pupils, contracting your muscles, your digestive system. So literally, the information that you take in from your environment impacts how your body responds. So thinking about that, like when you're feeling anxious, if you see, I like to use the example. So I'm a runner, and used to run a little bit more before I had the baby. But I love trail running, and I always would have to put my contacts in when running or wear glasses. And if anyone's run with glasses, they just fog up and they bounce everywhere. So I had to do that because when I was running, I would misinterpret things that I was seeing. So I'd be like, oh my God, is that tree a bear? Or like, oh, that stick is a snake, right? So I'm perceiving through my senses that there's some threat in the environment. So that's my vagus nerve is picking up on some of that information. And it's making my heart rate go up. It's making me a little bit more tense, right? So your mental well-being, right, that sense of anxiety is deeply connected to that physical response. So that's sort of the vagus nerve piece of it. The great thing about the vagus nerve is that just like it can respond and tense things up, it can also relax things. So one really great strategy that OTs use is tapping into the vagus nerve to relax it. So learning how to quiet down that vagus nerve so it doesn't have those really strong motor responses. That may be super technical. I'm not really sure. But simple things that you can do to work on that vagus nerve is singing, right? So the vagus nerve is connected to like the throat muscles in here. So singing, humming, chanting. And I think about like Tibetan or Eastern cultures and how much they value sort of those practices, and how many like the Buddhist Om, right? Like that is totally tapping into exercising and toning what's called the vagus nerve. So that can be really soothing and relaxing. There's some other things, specific interventions, but I won't go into it too much. The other side of the vagus nerve, or in general, all of this is general sensory processing. And so this is where, I think back to being a student, where I feel like most of my classmates stopped caring in some way, because so often sensory processing is seen as like this kid-based thing. And we put kids on swings and we, put them in a ball pit, and it's super sensory and it's for kids with autism or ADHD, right? It's really targeted to this thing. And I realized, I don't think it was through the school itself, but I think my own research, my own connections to individuals, that sensory processing has such a huge impact on our mental well-being, right? So, taking what would be literally an entire course that I could teach about this and putting it into a small, manageable package would be that our bodies have a unique way of processing the world we live in. So the way that I interpret the world is unique to myself. The way that you interpret the world is unique to you. The way that your parents, your siblings, whoever, they have their own unique way of interpreting the world. And so when we're in environments that are difficult for us to interpret, we may present as frustrated, as disinterested, because our bodies are struggling to handle all this information. I'm not sure if I'm explaining that so great, but basically for like personal example, let's use that. I get really overwhelmed with a lot of visual stimuli. So like if things are super cluttered and super messy, like my eyes cannot handle all of that. And so I do better in environments, and I'm looking around right now because everything on this desk is like just so. Like I like knowing, here's this, it's nice and neat. Here's this other thing, nice and neat. And now I'm able to attend and to pay attention to this because I'm not worrying about, oh my gosh, there's all this stuff over here and it's like driving me bonkers. So That was a super brief, not very thorough overview, but a good intro, I think, into the vagus nerve and some sensory related stuff.
Yeah, it is. And I always found it so interesting because I feel like it's very simple and basic, but it's also a lot to wrap your head around.
Yeah, it's tough. I find that I like to cater how I teach it to what people know. And I think that's also a very OT thing to do, right? We want to check in and see like, okay, what do you know? What do you understand? What's the best way that I can teach you? How do you learn best? And then I'll try to tell people about it. So if I find that people are hesitant to believe in sensory based stuff, then that's when I use myself as a personal example, because you can't refute my life experience, right? I know that I do better when things aren't cluttered or when there's not annoying rattling sound. Like I just can't focus when there's auditory stuff happening. And then if people still don't buy into it, or usually what will happen then is people share their experience of like, oh my God,
me
me
too.
too.
Yeah.
Or, oh, it's the opposite for me. And then I can provide some information. So usually there's some connecting point there. If they still don't believe, then I go a little bit deeper into the science of it. And then, sometimes I hate to pull this card, but like if they still don't believe it, then I'm dropping like really big words. So that it's like, this is a really scientific thing. This isn't, the playful child, sensory clinic that people think of, but like, no, we have afferent and efferent neural pathways and they generate our motor responses. And so that's why you get overwhelmed in XYZ conditions, or that's why it looks like this happening. So yeah, I like to, with anything, cater to whoever I'm with.
Yeah, that makes sense.
And I know you know all of this stuff.
Or I should know all this stuff. No, I do.
Well, I was gonna say, even just recognizing, even if you don't know it inside out, but recognizing that it's truth for some people is huge, because it I don't know, it's so freeing in so many ways. So like when I see folks, well, first of all, I default to people are inherently good. So I think everyone is really just trying to do their best, right? Mm-hmm. Like, oh gosh, I was just talking to my mom about how formula is kept behind, like locked cases in stores, so that people don't steal it. And, she was like, people steal formula. And she was having she's going down this negative path. And I was like, but they're stealing it so they can provide for their family. Like, yes, we don't want to steal ideally, but like it's coming from a good place. Like they're not just doing it so they can sell it on the street to somebody else, right? It is because they need to provide for their family. They are trying to do their best. They're trying to be inherently good in caring for their kids. It's just access to resources, makes things challenging for some folks. So then when I think about when I'm in the community or interacting with someone and they are frustrating me, I think, okay, well, they want to be the best person. Like this person wants to feel good. So what is it about it that's getting in the way? And that's when I think about sensory related stuff. And I'm like, is it too hot in here? And that's why they're getting cranky? Or did they not eat enough? So like that satiation interoceptive piece is getting in their way. Or is it too loud? Am I talking too much? Am I, any of the sensory related stuff, could that be impacting why they're not being their best? And like, oh, okay. Like it's freeing to know I can maybe support this person. I don't know. That's the way I think.
I love that so much. It's like a positive outlook. Everyone's trying to do their best. So what's bothering them that they're not doing their best?
Yeah. And then I think like, so when you were saying like that you may not know all of it, right? Which I don't even think I know all of it, of course, but like you understand that someone's environment could impact how they feel. And so, okay, that makes sense. Like you're not going to be like, oh my God, that person is just ridiculous and I can't believe they're doing these things. But there's a little question mark that might pop up for you and go, what could be happening for this person? Okay, like not ideal that they're behaving this way, but I get it because something might be challenging for them.
You're right. That's true.
Yeah.
And I think another piece to add to that, so like speaking on mental health, would be trauma related things, and how trauma impacts behaviors.
Yeah. Trauma is huge. So trauma sensory-based work are probably trauma sensory-based work, and I think what we call therapeutic use of self are like my 3 favorite things ever. It's weird to say that trauma is my favorite, but it's my favorite in that it really helps to explain how people present. So that basic piece that we were just talking about, like what may be getting in people's way. And there's like so much that can be done to support folks who have trauma. And I feel like even just validating people's experience of trauma is huge for that person. And it has such a huge impact on our communities. So like, it is very much so like the village mentality, right? Like if somebody has trauma, like that is going to trickle into other people's lives. And so why wouldn't we want to support these folks and make them feel, that they're safe in whatever regard? So yeah, that's another piece I think about when people are, when I see that people are struggling, is I think, what has their life experience been like that leads them to behave this way? So, I think some people would say, I don't know, that I'm too, not too kind. Like, there was a term that used to be used a lot when I worked in group homes, where it's like, you didn't hold people accountable or whatever it might be. And I'm just like, no, I just recognize that there are a lot of factors that are influencing whatever they're doing. It's not as clear cut as people make it seem. And man, wouldn't that be so easy if we could just say, oh, it's because of this that they're acting this way. Like, no, there's so many variables. So like, is it the present environment that's making this person distressed? Or is it something that happened to them that they subconsciously aren't even aware of from their childhood? That's like, oh, that's why they're reacting this way.
Right.
And then as a clinician, or even as a human being, to think that you could be a part of that person's life to make them feel safe and change the trajectory, like, why wouldn't you want to be involved in that? If it's so easy as just saying, I hear you, I accept you, I see you. Like, that's so easy to do.
Easy, yeah. And that, the little things, that could be all they needed to hear, or somebody like that in their life. Yeah. That reminds me of my the last fieldwork that I just finished, my second fieldwork. I was at a behavioral health school / group home with what they call behavioral kids. They're not but
you know how I feel about behavioral. I hate that word.
That's like, I would have to do this when I talk to kids or anybody. But yeah, I was like, I was slow to like build rapport with the kids because I knew they had a trauma background. That's what they emphasized in orientation.
Yeah.
So I did not want to trigger them by anything. Like, even saying hi, I was like, I don't know. Yeah. I was being a little bit over dramatic, but at the same time, it's like, you never know.
Yeah.
And therapeutic use of self was just like thrown at me. Like, that's something I really had to learn to do and learn to be the person that they needed in the moment, or just like support them with like sensory or just seeing them and hearing them. And I would always like ask myself with that question, so like, why are they behaving this way? What brought them to this placement? Like, why are they not at home? Or like, what's going on, really?
Right. Yeah. So you're also taking that mentality of like, they're inherently good, so what's keeping them from getting what they need, right? Like, that little bit of curiosity goes a long way. Because when folks have that perspective of, oh, it's this, you are limiting yourself to literally only seeing that.
Right.
Like, if you're curious and you ask, what's happening here? Like, oh my goodness, the things that you could be seeing.
Different people, different perspectives, because I'll be like I see the good side of these kids. Like, they could be like really bad, but I'm like, they're actually really sweet. If you when they're good, they're really good.
Yeah.
But then like, I think when people see the bad side of kids, they just kind of run with that and like, oh yeah, they're a bad kid. They have behaviors. They're this, they're that.
Yeah.
Behaviors. And we'll be like talking with their teachers or different clinicians, and they all have different perspectives from just based on what they see and not from like a clinical side of things.
Yeah. It's tough. And so, and I think about the fact that you said, you took your time in developing those relationships. As a student, especially, that can be tricky because there's this pressure to be a therapist and a practitioner, and you're supposed to be doing interventions. And if you're not, then what are you doing? But the therapeutic use of self and giving the individual time is an intervention, right? It's honoring their experience, and it's thinking like, what is the best way to approach this individual? Do I want to say hi now? Do I say hi? Do I say hello? Do I just wave? Do I surprise them? No, we're not going to surprise them. We know that kids with trauma don't like surprises. Do I do it consistently at the same time? Like you're thinking about all of these things, and maybe you didn't even recognize all of those pieces that you were thinking of. Mm-hmm. And so too, like thinking about beyond being a student, like working for an agency that genuinely appreciates and values trauma-informed care, that recognizes that things take time, is really important, because otherwise there is this pressure to do the work. But doing the work is taking your time. So I always tell stories about kids that I worked with who would literally cuss me out for like 3 months straight and say they're not coming to group and they're not going to go to treatment. Mm-hmm. And I remember I would just think to myself, this isn't personal, right? They aren't attacking me. Like this is just their expression, and they're totally allowed to say that. And sometimes I would just say, thanks for communicating. Like, mm-hmm. I'm going to recognize the fact that you could have just walked away and said nothing, but you are telling me how you feel. Now, granted, it's not the words I'd like to hear, but that's not on me to choose your words. That's on you to choose your words.
Right.
But by not taking it personally, right, and by showing up the next day with the same amount of energy of like, hey, you want to come to group? Cuss me out again? Sure, whatever. Hey, you want to come to group? Like, oh, now I'm predictable. I'm a safe person. I'm not going to yell at them because they're communicating or expressing they don't want to do something. Like that's their choice, right?
Yeah.
I can't make them do that. And then that's when things start to come together, like I feel like they come together really quickly. Once you gain trust, mm-hmm. for the most part, if you've gotten there nice and slow, right, then you're in. And there may be, of course, some challenges to that, but I feel like in my experience, kids and adults really appreciate when you honor their decisions. Like, what a weird thought that like expecting what somebody wants could mean so much.
I know. I've had those experiences. This one student just did not want to do OT anymore, and I was like, okay, I obviously can't take it personally. I'm only there temporarily as a student, and I was just like, well, thanks for sharing that. Thanks for communicating that, and good job, like letting us know. Otherwise, you wouldn't have known how you felt about coming down here.
Yeah,
so just validating.
I'm just curious, like, what were some of those kids' responses when you were like, okay, that's fine?
They were actually really like cool about it. They're pretty calm. They're just like, okay, you hear me? Like, hopefully I don't come here next week, but it wasn't anything bad.
Yeah.
It really caught me by surprise, because it was like at the end of the session, mm-hmm. they kind of just blew up, and I was like, whoa. I don't know. I'm good at staying calm, and then I'm always calm. But like I was like, okay, thanks for letting me know. I'll talk to the supervisor, whatever. But thanks for letting us know.
Yeah, that's a great skill set to have, is that ability to remain calm. Mm-hmm. Because I feel like now I'm thinking like, oh man, if I was in a really wild situation and Roslyn was there, how, like, I'd probably look to you and be like, oh my gosh, can I just be next to you? Just because like you're so steady, and in chaotic environments, that's what we want, is something that's predictable and steady. And so like, oh, I know exactly what to expect from you. I'm gonna go closer.
Right. It's either that, or I'm just really like slow to process what's going on and what to do. Next I'm like frozen.
Well, let's call that deliberate. You're really deliberate. You think about what to do.
Yep. I'm thinking about it. That happened. Like it didn't happen often. A few students would blow up, and I would kind of freeze. But it was like, okay, just keeping calm, cool, and professional. But I'm also like, I don't know what to do right now.
Yeah, I feel like no response, or not no response, but taking your time to soak up the information is better than, I think, what some folks do, and they have that quick reactive, like, and then you're just adding to the chaos,
right?
Which is tough to teach. And thinking about trauma itself, like sometimes that's both of those. I would say the polar ends, the freeze part and the really reactive part, could be its own trauma response.
Mm-hmm.
So sometimes, and I share pretty candidly, like I have my own trauma experience. And so like I'm aware of environments or situations that may agitate things. And so when I'm starting to have a reaction, I have to think, okay, what do I need in this moment? Because this isn't about the relationship between me and the kid or whatever is happening, but this is about my stuff. So like, how do I step back before I jump in here?
Right. It's that whole like taking care of yourself so you can take care of others.
Yeah, I can't pour from an empty cup.
Right. Yeah. Exactly. Oh yeah, you did say something that I was gonna add to about perspectives. Back at the placement I was at, we have students if they like get out of program, they're placed like in the basement. It's not like a
Ooh.
dungeon. It's not it's just an area where all the offices are, and there's an
Okay.
empty room, and it's in the basement of the building, but it's not
Okay.
like a dingy basement.
Okay.
And yeah, so they stay there. I don't know how long they're there for, but all the OT offices are there.
Mhm.
And after we left, I guess the kid was there overnight, and there's just holes in the wall. Like he
Mhm.
used a file cabinet, something like part of a file cabinet. He like destroyed it and just like destroyed the wall. There's like holes in the
Okay.
wall everywhere. Yeah, and so everyone's reaction the next morning was like, "What happened down here? Like this is bad. This kid, like who was this kid? Who let this happen?" Stuff
Mhm.
like that. But my supervisor, her OT perspective was like, "Okay, I see the walls. He likes the pressure. He likes the heavy work. He needs
Yeah.
that input because." I think the janitor, he heard the kid say while he was doing it, like I think the kid was saying like he likes the feeling or something that he
Yeah.
likes. Yeah. And so the
Yeah.
OT, she was talking to the janitor the next day and she was like, "Oh, he needs OT." So she started like, she's sending out emails like, "Can this kid benefit from like brushing or
Wow.
heavy work?" And I was like,
Good,
wow.
good way of looking at it.
Yeah. I was like, that's
And
like,
I think that sort of speaks to I feel like that curiosity piece about like, what
Mhm.
could be happening here?
Yeah.
Versus the, oh, this is bad, we must punish this.
Right. Exactly.
Right. You
Like,
punish it, you're not really fixing it though.
no, you're making things worse.
Yeah. It's one of the things, I'm not sure if maybe you had this experience too working with kids, but there's this, I think a lot of times too, there's this jump to punish and to take things away and whatever. And it's very rarely paired with like the teaching part of like what should be done instead, or
Mhm.
what can we do to support you. So it's like, oh, they didn't get on the bus in time, so we're taking away their TV. It's like, well, did we think about how we could support them so they could get on their bus in time?
Yeah.
Like,
It's
are
like,
we just
why?
taking things away?
Yeah. You
Yeah.
have to always ask why. Like, why did this happen or what's impacting this behavior?
Yeah.
And that's what my placement was really good at, like teaching moments instead of
Yeah.
just they never took things away. They would like either you don't earn, they had like points to
Yeah.
earn, either you don't earn points and you learn why, or you replace behaviors, things like that.
Yeah.
But they would not take things away.
That's so I know like our mental health stigma and the perspective of mental health is like shifting for the positive, like where people, especially when I think about like the work being done with men in mental health, and men can't be sensitive and blah 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 blah. Now there's like this, men are openly expressing their mental health challenges. So like as an example of like, okay, we're becoming more accepting and whatnot. I would love to see a shift where we don't think about punishment the same way. And I guess sort of speaking to the trauma piece, like that I feel like so many people say like, oh, you're letting them get away with it or
Mm-hmm.
whatever. And it's like, but are you considering what may have impacted them to get to the point that they're at, and like being more understanding of that? I just feel like I see so many things on, of course, Facebook,
Mm-hmm.
where it's like people are so quick to judge and jump to conclusions and say, take things away and don't do this. And, people have no respect anymore, and teachers let kids get away with everything. And part of me
Yeah.
is like, no, we're just being more trauma informed. We're recognizing that there are different circumstances that impact how people, do their lives, and what people, I don't know, how people respond, and that always being punitive is not helping.
Mm-hmm.
And I feel like right now, especially, and maybe it's just because I see it more on my Facebook timeline, but like people are a little bit more heated and contentious about it, and feel like, oh my gosh, we're being so soft and everybody's a snowflake these days. And it's
Yeah.
like, no, we are just recognizing the variables in play and like trying to think creatively about how to support people instead of just dismissing them and, being punitive.
Yeah, exactly. When I learned about trauma-informed care, I was like, shouldn't this be happening everywhere? Like, why is this why am I
Yeah.
learning about
Why
this?
is this a thing?
Yeah, exactly. Like, why is this why is this a
Yeah.
new thing?
Yeah. I think
So,
about that so often when people ask me to like teach or present on it, because I'm
mhm.
like, what do I present on? Like, it's just so, to me, so duh. So like,
Yeah.
this is how you should just treat people. So part of me wants to be like, trauma informed care. Like, there's the title slide. The next slide is just be a good person.
Oh
The
yeah. The
end. That's all you need to do.
Yeah, it's in the word, like trauma-informed. I think everyone should just like knowing that everyone has gone through something.
Mhm.
Just be careful about that and be a nice like be a good person around.
Yeah. When I do the teaching for it, I sort of think I like default again, like, well, people know that they should just be good, right? Some people unfortunately don't.
Very
So like to justify that, I talk about the science behind it and like what does trauma look like? And then what is it like in the body so that they understand like, oh, this isn't just a reactive response. Like, no, this is somebody who is like physically, like we talked about earlier, like physically processing things. And because of the way it's interpreted, this is what it looks like. And so trauma informed is recognizing this is what it's like in the body, and this is what it looks like out here. And here's how you help, like those vagal nerve interventions,
Yeah.
or, things like letting kids choose where to sit in the classroom, or having a dimmer switch instead of just having it to like full bright light, and understanding like, oh, those things can impact the body. Yeah. And like a trauma response. Absolutely.
Mm-hmm. It's weird to think about how like these are adults we would be talking to or students even. So it's like you think that we've all grown up in a non-trauma informed world. Or maybe we have, but not so in your face, I guess. Like subtly. But
Yeah.
we've all kind of like this is how things are. There's no changing it, and if there is, it's probably like a big deal.
Yeah.
So it wasn't as trauma informed. You kind of just roll with what you have.
Yeah.
But now it's like more intentional.
Yeah. Yeah. And I think, I don't know, I guess when I think about like systems and agencies, I don't know if agency is the right word, but like maybe they weren't so trauma informed. Again, thinking about like the punitive side of things, like there are so many changes that have happened in like residential work where, I mean, I think about, gosh, like I used to work at a program where they took the shoes like the minute the kid came into the program because they were afraid that they would run away. Like you're not just why can't the kid just wear shoes though? It's just shoe, like they're gonna run with or without their shoes if they want to run. Like, why don't we just let them have the things or have a conversation or something like that? Or even, gosh, like giving them a little bit more choice in the meals that they're eating. Like, shouldn't kids be allowed to make those decisions? And if they don't want to eat that thing, like have a conversation around what they would want to eat instead of saying, well, if you don't want to eat, then you're not eating anything. Like, and those were again, like those are things that are just so duh. Like, wouldn't you do that? But I think for agencies and services that have like protocols, like this had to be a really major shift around things.
Right. I wonder what that was like. Oh no, we have to treat people like people now.
Yeah. Oh no, we can't put them in the basement. No. Yeah. It's it's so funny, like having this conversation with you, it's so duh, but I can remember being in the group home and just thinking like, why doesn't this staff person get it? Like, how do they not understand? So there is like a component. So I guess I wonder why it's a duh for some people and why other people don't see it. Like, is it education based? Is it life experience based? Where like, I know, and maybe life experience in terms of also where your healing is. So for me, like, I know what would work best for me. And so that's what I try to give to my kids. So it's a duh because this is my life experience. So of course I would want to be treated like this. So of course I'm going to treat you like that. But I also have like the awareness and ability to reflect I'm like, oh, I didn't do so well when people approached me this way. And so I would like it better. If you only know one way, how do you know that you could be treated a different way? So I guess when I think about like staff, and for the most part, staff that I've worked with definitely have their own trauma histories. And I don't remember if I told you, but I had done an ACEs study in service with staff where they actually had to record their ACE scores. And there was a staff person that had an 8. And we could talk about the ACEs too. But like that made me think like, wow, our staff have gone through significant trauma. And so that may be impacting either their ability to provide trauma-informed care because they're not at the place where they recognize like, oh, there's different ways of doing this, or they're becoming so, I don't like the word triggered. So I've been trying to think of a different word. They're becoming so, I don't know what word I would use, triggered by the environment that they're having their own reaction. Mm-hmm. What is a different word for triggered?
That's a tough one.
Yeah. I just feel like it's, I don't know. I don't like the word triggered. I'll think about it. I'll let it simmer.
Yeah. I feel like it could be misused easily.
Yeah.
Yeah, let's talk about the ACEs study and the scores and what that's all about.
So the ACEs study is a pretty monumental study that was done on trauma. I want to say it was in the late 90s. Okay. So first of all, I highly recommend, and I know that I've shown it to you, but Dr. Nadine Burke-Harris's TED Talk on, I can't remember what it's called. It's on childhood trauma, but childhood trauma, that might just actually be the title of it. But she really nicely talks about the ACEs study and her work that she's doing as an actual physician. So the ACEs study looked at something like 17,000 individuals and administered this questionnaire of 10 ACEs. So ACEs stands for Adverse Childhood Experience. So the individuals were prompted to simply check yes or no to these 10 questions, and they were related to emotional abuse, physical abuse, sexual abuse, like parental incarceration was one that was on there. Domestic violence was a piece that was on there. Neglect. So these 10 questions related to potential, traumatic experiences. And ultimately what the data showed, oh gosh, I can't remember the stats in specific. I'm tempted to say, I don't even want to get it wrong, so I feel like I should look it up. But overwhelmingly, people had at least one ACE, so at least one experience of childhood trauma. And as they looked through the data, there were significant health outcomes that correlated with their ACE scores. So essentially, the higher the ACE score, the more significant your health, like well-being, physical well-being was impacted. Things like asthma, which is one of my favorite things to point out, heart disease, lung disease, COPD, your likelihood of substance use or substance abuse, depression, suicide, like, I can't remember, it was like over 200 different health outcomes were correlated. So the really interesting piece about that study is that it wasn't done in like a low socioeconomic neighborhood, 17,000 people who were poor, from these, difficult upbringings or whatnot. But this was done with like middle-class white folk in California. And so it sort of highlighted the fact that you don't have to look a certain way or be of a certain group or socioeconomic status to have experienced trauma. So it really made this idea of trauma is universal. And so when I think about trauma-informed care, there's this assumption that I carry that everyone has experienced trauma. Like I cannot assume otherwise, given the data and the evidence that's out there. And I'd also say, those 10 questions were really significant experiences of trauma, but we can have other experiences of trauma that could be, these sort of long-term chronic experiences or these little blips of acute trauma or these like small compounding pieces of trauma. So it may not be a singular event that we think as traumatic. And so therefore I just default to 1, people are inherently good. And 2, everyone has a trauma history in some way. They have something that's been traumatic.
Right. And trauma isn't always something that has happened to you personally. It could be witnessing
Yes.
something in that.
Yeah.
And
And
yeah.
no, keep going.
Oh,
Sorry.
I was gonna say honestly, when I say that, I think that absolutely we've all seen something traumatic. Thinking about the
Mhm.
news recently,
Yes.
we've all so everybody has trauma. It is universal, as you said. Yeah.
So I started reading a book. I didn't finish it. I get a little distracted sometimes. It talked about, so of course we have like our own trauma, but there's also shared cultural trauma. So we may not have been, I think the example that they gave was actually slavery, and how the trauma of ancestors literally, and this is regardless of slavery, any traumatic experience literally changes the DNA. So like you literally hand down your trauma to your future generations. And so we think about something significant like slavery or the Holocaust, right? Those had significant impacts on groups of people, and that DNA has been changed, where folks living today are carrying the trauma of their culture still. So you may not have a direct connection to slavery. You may not have been enslaved, or you may not have been at any of the Holocaust camps, but you could still carry the trauma of your ancestors, which is like, I feel like that would be something, you know, when I think about those people who call everybody snowflakes, right? Like that would be something I feel like they'd have a hard time believing.
Oh, absolutely.
But there's science behind it.
Wow.
And then there's this idea of institutional trauma, where you've been failed by the institutions that are supposed to protect you. So of course I think about the police and how some people have felt around that, or the judicial system and feeling like, gosh, I even think about, I recently, within the past year, 2 years, had to file a restraining order on someone. And when I went to the court, oh gosh, it was such a traumatic experience. Just, well, the need to do the restraining order was one, but then actually going into the court and having to see the person who I was filing this restraining order on. And then it was a male judge who I had to plea, like argue why, like why I was justified in saying that this person should stay away from me. And I thought about how many instances where, like, so I have a knowledge, a background of trauma, and I know like how to calm myself, like the strategies I can use in that moment. But how many men or women are going into these, you know, courts and having to say these things in front of the judges, and then being failed by the judge because they're not articulating well, or they didn't present the evidence in whatever way. And like, oh, that's a traumatic experience too, like being failed by the system that's supposed to protect you.
Right.
There was something else I was thinking too with trauma. I don't remember. I got so excited talking. So this is the stuff I get excited about, because it's like we can do things about this and we can help people. Again, that community vibe of like, if we can help one person manage their traumatic experience, like then they can go on and do great things with their life and maybe help others. I'm not saying that they have to, but just knowing that one person is able to live a better life because you're honoring the way that they live and honoring their life experience and making them feel safe. Yeah, I'm all for that.
Yeah. That's really eye-opening, the generational trauma and shared cultural trauma. Yeah.
That's what I was thinking. So you had mentioned like seeing things on the news as being traumatic.
Yeah.
And I think, I'm sure most people recognize, maybe most people recognize that it is like you may not have to be at the event to witness it, but you can still have trauma from witnessing it and a trauma response from it. And so when I think about, gosh, unfortunately, there's too many videos, which tells me there's too many incidents in general of things happening. Of course, I think about police in race-related issues, but like when I'm watching those videos, which this is a whole nother issue. I go back and forth on whether I should watch them, but like part of me feels like it's privilege to not have to look in some ways. But at the same time, I know that watching disrupts my mental well-being. And so when I'm thinking about doing these things, I have to think, what, if I'm going to watch it, what do I need to have in place before I watch? And so that's sort of advice that I would give folks. Like, if you know you're going into something that's potentially traumatic, have what I would call a safety plan in place, where it's like, all right, in the event that this does dysregulate me, what are 3 things that I can do to get back to center? Or, something I also try to do is, like, the people that I'm close to, I'll tell them I'm going to be doing something that's going to potentially dysregulate me. Like, I'm going to need these things afterward. Because sometimes, a lot of the times, when you're having that trauma response, you can't get up to the front of your brain where you make good decisions, right? You are just living back here in your trauma. And so having somebody else who can support you and who can get you calm and regulated so you can go back to making good decisions can be really helpful. So I will tell, like, my husband, I'll be like, I just went through this, and so I need this right now. But, like, being able to clearly communicate it, or saying, I know, I have something really challenging coming up today, and so I need these things. Having that self-awareness and the ability to communicate it.
Yeah, that's huge. Like being self-aware and acknowledging what you need, or identifying what you need and what will help you. That's another challenge in itself, I feel like.
Mm-hmm. Yeah. And so these talks are great because I'd like to think, someone can take some piece of this and go, oh my gosh, I relate to that. And so now I can use this information to be better. Not that we always have to be better, but this idea of, like, to be better for you, to feel better for yourself, not like to be successful and to make lots of money, but, like, no, to be able to live your day without, having that little voice that pops into your head that says whatever negative thing, or to not have that physical reaction when something is distressing.
All right, that's super, super important. And I feel like there's so many takeaway messages from this conversation right now. They're everywhere. Back to the ACEs study, when you talk
Yeah.
about the outcome of people's trauma, do you think that with intervention, would that decrease the outcomes, or is it like predetermined?
Good question. So the greatest thing about the, like, suggested intervention for the ACEs. So, like, okay, great, you have 4 ACEs. Now you're, like, predetermined to have COPD. Like, that's not the way it goes. You're at an increased likelihood. So the number one way to buffer against the negative impact of the ACEs is to have, and I can't remember the exact wording, but it's essentially a consistent adult person in the life. So of course we're thinking about childhood ACEs. So anything that happens between birth to 18 years old. So if there's a traumatic event that happens for an individual between their years of 0 through 5, if they have a consistent and loving, unconditional adult in their life, the potential negatives of the ACEs is decreased. And I would reason to say that it doesn't matter if it's in childhood, but in adulthood. So when I reflect back on what has been helpful for me, there's no particular thing I did. I started running, so that helped regulate how I felt, certainly helped me feel better about things. But it was actually having my best friend, who was, again, like, consistent. Like, if I was really angry one day, like, she'd be the same sweet person the next day. If I was struggling and really emotional, like crying, like, she would be so supportive. And so no matter what was happening in my life, to have that person to come back to, that's what helped me build and sort of build my recovery. Then I too, of course, think about my husband. Like, I get a little bit wild sometimes. Like, I just get overwhelmed still. And it's just so great because no matter how I show up, like, it's the same love that's coming from him. And so one of the things that you can do for kids with trauma or adults with trauma is to just be there and be their person. So recognize that, yep, they're having a reaction. It's not personal, like we talked about before, and keep showing up and keep giving that consistent, unconditional, positive regard of, like, I'm here for you. You're safe. Like, and as, of course, people start to heal from their trauma, different things are going to come up and boundaries are going to get tested, but that is just their way of seeing, like, is this situation still safe? And if you remain their person and you recognize that things ebb and flow, That's the one singular like intervention that can be done to support.
Consistency.
Yes.
Consistency is key. Yeah.
Yeah.
I feel like with the population I was with, I keep talking about my field work. I don't think the kids are receiving that consistent person, with at least with the students, because we're in and out all
Right.
the time. And like, it was tough to like tell them, I have to leave now. My time is
Yeah.
up here. And they're used to students, but they're also confused. Like, why there's this
Yeah.
new person coming? So I was like, that's not good for this certain population, or
Yeah.
well, specifically that population.
Yeah. It's tough. And too, thinking about like a lot of those sites, just thinking about where I work, like they have high turnover from staff.
Yeah, that too. A
So
lot were leaving. Yeah.
yeah, so you get kids sometimes that may connect really quickly, and then you get kids who don't connect at all because they recognize that staff are just leaving. I think so much about, of course the kids are in the program, and there's this thought of, they don't have whatever it takes and to go home, or maybe their skills aren't developed as well. But then I think about like adults that I know, and I feel like sometimes those kids have way better skills than some of the adults. Like they're comfortable for whatever reason, maybe it's trauma related or otherwise, but like they're comfortable sharing things, and they will say things like thank you and please quicker than some of the adults that like I just generally interact with. And so
no, that is really true.
Yeah. So it's thinking about turnover and building those healthy attachments, it's so important. And at the same time, there's a lot of adults who don't have that skill set.
It's true. It's that like they are constantly practicing it, and they're constantly identifying like coping skills. Like a lot of kids would be like, "Can I have this as my coping skill?" Like a lot of adults don't even know what they need to cope.
Yeah.
It's really interesting.
I know we should all just do our own safety plan. Just like, when I feel overwhelmed, I can do. All right, what 3 things? Great. That's all you need.
Yeah.
Yeah. You can write them down on a card and put it in your wallet, and then you'll never forget.
That's a great idea.
Yeah.
I have to do that. I need to figure that out too. Because I feel like I tell myself I can handle situations. I'm fine. I don't need anything. I think I'm just gonna make things worse for myself if I don't address things at all.
That sort of brings it to like the idea of self-care too, working with the populations we've worked with. Like you are hearing a lot of sometimes hearing and witnessing a lot of intense experiences. And so, vicarious trauma, certainly, but also like, how do you reset yourself afterward? And I get asked that a lot from some students when they're asking about, you're hearing again, like all these difficult stories of life experience, like, what do you do? And I had a kid once who, I think it was the second time, the first time I ever witnessed a restraint. And it was super dysregulating for me. And I remember it was like 15 minutes before I was supposed to leave work. So I had the luxury of like, after the restraint was done, like getting in my car and leaving. Granted, I literally sat in my car and just like, I think I cried for a little bit. And then I think I called a friend. I just thought like, I need to have something that I can do, like whether, crying counts, but like calling someone to like decompress, like making sure that the stuff doesn't, I don't know, like they're heavy, real experiences. This isn't, somebody spilled something on a t-shirt at a clothing store. Like this is somebody, you watched a kid get physically restrained by these 2 large adults. Like, wow. Okay. How do you process that? And then also, how do you go into work the next day? And so one of the things that I did, which I'm not sure if it's done all the time, but like I actually sat with the kid and said, I had a really difficult time watching that. Like that was hard for me because I felt for you in this situation. And I don't think a lot of the kids really ever got that in the group home where I worked. Like it was so, I don't know, disconnected. But so for me, part of my safety plan was processing with them and like letting them know, like that was hard for me. I can't imagine what it was like for you.
Well, yeah, I haven't heard. I don't think that's a thing. That's the first time I've heard that. But was that helpful for the kid, or were they like I know. What was that like?
They were definitely caught off guard because
Right.
it's just something that it happens and nobody really addresses, nobody really talks about. Like, I don't know, there's so much value in sharing how you feel as an adult too. It also models like how you should communicate.
Mm-hmm.
But I wasn't doing it. I was doing it for them in some way, but I was doing it because like I needed that, but it wasn't selfishly motivated. Like I was thinking about it as an actual intervention. Um, Sorry, they're mowing the lawn next door.
Oh, okay.
um, so I think in a real trauma or true trauma informed environment, we should be having those conversations and
Mm-hmm.
not like, gosh, I guess I'll share more. So growing up, witnessing domestic violence, like my parents would argue with each other and get physical, and then there was no resolution. I never saw them talk it out, or not even talk it out, but it was just like this weird, like, oh, that just happened, and for 3 days we're not talking to each other, and then suddenly things are back to normal. And so that's not a normal process. And so when I think about these kids or anyone who's been through some sort of experience like that, like showing like we can have a conversation about it and it can be safe. Like we don't have to pretend like this never happened. We're not denying this experience for you. Like, let's talk through it and figure out how can we prevent these things, or what did it feel like for you, and what do you need to help? Because no one else, if we're not talking about it, we're not doing anything. Not only like it's not that we're not making things worse, like we are making things worse by not having the discussion.
Mm-hmm.
We can't just pretend it didn't happen.
Exactly. And
Yeah.
we shy away from those conversations because we don't even know why. Like it's discomforting, or
Yeah.
we just want to ignore what happened. But the impact,
Yeah.
you have to
Right.
address the impact because that's huge.
Right.
Yeah, that's part of trauma responses.
Yeah, definitely. Tough conversations they're tough for a reason.
Yeah,
but they're valuable.
absolutely. You just have to get your brain going. Like, you just have to think and
Yeah.
be okay with tough conversations.
That is the, going back to sort of what we started on, like that is the leaning in part, right? Like the benefit here outweigh, like not doing, I don't even know if I can phrase this right. Doing something that outweighs not doing anything, right? Like we have to do something. We have to lean into that discomfort. Like it is for not just the better of this child in this moment or the adult in this moment, but again, thinking about like how that can initiate this, like, oh, I feel safe. The world is safe. Now I may not, this is of course over time. I may not have these, large trauma responses anymore because I have this individual who's taking the time and having these conversations, making me feel safe.
Right. We talked about a lot. Some deep breaths.
Yeah.
We can wrap up. I'm just gonna ask you one last question.
Okay.
This is a big one. What is the message you want to send out to all the listeners?
Oh man. What is the message? Oh, well, if I could tell anyone anything. Oh, okay. I've got like two things now. Okay. One, I would say challenge yourself, if you don't already feel this way, but challenge yourself to believe that people are inherently good, right? And off of that comes like this get curious part, right? If someone's not doing something good, what could be impacting that? And the second part is really simple lessons. Be a good person. So we talked about trauma-informed care and how it's really like a duh. Well, it's a duh because, Roslyn, you're a good person and you know what it's like to treat someone the way that they want to be treated, the way that you would want to be treated. And so default that people are inherently good, get curious if they're sort of not. And then from a trauma perspective, like just be a good person when you're interacting. And I guess I'm going to go one more thing because I'm thinking about mental health and taking care of yourself. And I would say recognize that your environment has a strong influence on how you feel. So sometimes you have to switch up your environment to feel better. Sometimes you cannot think yourself into feeling better. You can't be like, oh, I don't want to be depressed anymore, or I don't want to be anxious, so I'm not going to be anxious. No, try switching up something in your environment to see if that makes a good change for you.
Yes, awesome messages. I love how simple they are, but we did talk about the why behind these messages, so
yeah.
Yeah, be a good person.
Be a good person.
Don't even think about it.
Inherently good. People are inherently good.
Yeah.
I think if we thought that more often and got curious, and two, thinking about yourself too, like you are a good person too. Sometimes we feel like maybe we're not so great or we're not doing what we should be doing. Like, no, you're doing great. You're a good person. You're doing the best you can with what you got.
Exactly. Oh, those are really, really good messages that everybody has to hear. Well, thank you for being on the show. Yeah, it's great talking with you.
Yeah, this was great. It was nice to see you.
You too. It's great to hear your voice again too.
Yeah. Thanks for this opportunity. I told you it made me a little uncomfortable, but I leaned in. And look I'm okay.
Yeah, we made it through.
That's right. That's right.
I was nervous too, but I was like, if there's one person to talk about mental health with, it's definitely you.
Thank you. I appreciate that. Yeah. This has been encouraging, inspiring, validating, reminds me of why I do what I do. So I appreciate this opportunity from that perspective as well.
Thank you so much for listening. Hope to catch you in the next episode. All music provided by Stubborn Saul. Be sure to check him out on all music listening platforms at STBRNSAL. He also has a website where you can check out and purchase his merch. Stay safe, stay healthy, love you all, peace out, and take care.